morning. Welcome to Green Spring Village and Village in Motion. Today is Wednesday, August 17th, 2016. My name is Susan Gerhard, and I'm here this morning with our guest, Nancy Earle. Nancy comes to us from our Outpatient Rehab Department. Good morning.
Good morning.
Nancy, tell us a little bit about you.
Okay, I'm a physical therapist. I have a doctorate in physical therapy, and I've been with Green Spring for 9 years. I also have some certifications, including pelvic floor rehab, which we're going to talk about today. Also certified in LSVT BIG for the treatment of Parkinson's disease. So that's kind of a little bit about.
And what interested you in your life to get into physical therapy? I'm always fascinated about how careers are chosen.
My mother's a nurse, and my father's a veterinarian, so I've been around the healthcare and just helping people and helping animals.
Kind of finding your place to help.
So I've always wanted to help people, and especially in a profession that helps them feel better about themselves, and physical therapy seemed to fit just right.
Well, that makes sense. So we certainly come here this morning with a topic that is going to help people feel better about themselves.
Yes.
This is one of those topics that falls into the heading of our mothers told us never to talk about this in polite society, correct?
Right.
And it's the topic of incontinence.
Right.
But I think we come here with what I think is really terrific news this morning. And you told me this morning that incontinence doesn't have to be a part of aging, correct?
Correct.
Tell us a little more about that.
Okay. Incontinence is, there are many types of incontinence, and one of them is stress incontinence, there's urge incontinence, the different types. Basically, the way it falls into physical therapy is that it can relate to weakness of the pelvic floor muscles. So physical therapists that get trained in this can help strengthen these muscles. We also do things to help, they're called behavior modifications. So just some little changes in lifestyle that can help make a big difference.
So incontinence isn't necessarily something that starts at a certain age. Incontinence is something that can happen in a younger person.
Yes.
We've all known of cases when someone coughs in the middle of a bad cold, or sneezes, or even is in the middle of hilarious laughter and realizes, oh my gosh, I have a problem. And that can happen at any age. But whenever something like that happens, that is the person's body telling them that the muscles that control that part of the body's evacuation system, to coin a phrase, maybe need a little strengthening. Is that correct?
That is correct.
And those muscles can be strengthened at whatever age?
At any age, correct.
And you're telling us that in physical therapy, you can help us strengthen those muscles.
That's right.
And there are exercises to do that.
Right.
Obviously, we're not going to practice those exercises here today.
Yes, exactly. I didn't want to come out with anything that might be too much information.
Right.
But I did want to at least introduce the idea for people that may be having this problem, that there can be a solution or at least help for it.
Right.
They would need a doctor's referral to come to physical therapy. You gave a perfect example of what's called stress incontinence. A little bit of urine loss with sneezing, laughing, coughing. Oftentimes, I have residents have trouble going from sitting to standing as well. That's also
a
stress incontinence.
Right.
So there are exercises, just like any muscle in the body, you can strengthen the pelvic floor. And home exercise programs that I give to people, and there's often quite a difference. So it does take a little bit of time, usually about a month before you start seeing some improvement, but
it's one of those things that it's never too early to start, correct?
Yes, yeah, and it's never too late.
Right. Oh, and that's a very good point.
Yeah. You know, it's a good idea if someone is noticing problems, and usually, they may be going to the drugstore to buy pads or some kind of protection like that, that's when you know, okay, maybe I should get some help for this.
Right.
You can, even if it's a little problem. I even have some people that aren't having any urine loss, but they're getting urges. So that's another thing to know, is that it's not always about urine loss. It can be strong urges causing someone to rush to the bathroom, and that's something that we can work on too.
And that's the time to go to your doctor and say, hey, I understand that my
Yes.
physical therapy department can help me. Can you give me a referral?
Right.
And this is normally covered by insurance and Medicare?
Absolutely.
Okay, that's a good
Yes.
thing to know.
Yes. It's typically, I actually see people for only 3 or 4 visits. It's once a week, and by the 3rd or 4th visit, they know their exercises, they're doing fine, and I discharge them. So
And the
they're
key
fine.
is to practice the exercises regularly.
Yes.
It's
yes.
not one of these once a week when I think
No,
about it.
no.
I know I should do
Exactly,
this, but I
exactly.
don't, because if you don't do them regularly and often, they are not
Yes.
going to help.
I can guarantee you, if you don't do the exercises, it won't help. Yeah, that's true. But I usually tell people, if you're coming to PT, give it a good effort, at least for a month. If you find no benefit, then we know it didn't work. But even before taking medication, or, for incontinence, or, pursuing other avenues of treatment, try physical therapy first and see if you can strengthen the muscles that way before, doing something more drastic.
So you bring up another point there, is sometimes there are, and I just remembered seeing commercials on television about this, sometimes exercises are in coordination with a drug.
Oftentimes, the doctors, especially here at Green Spring, will refer someone to PT first before they try medication. If the physical therapy is not helping, then they look at other options.
Okay.
So, yeah.
Always better to do the do-it-yourself route
Right,
than to depend on a drug.
right. And it's mainly the side effects. Most people go on the drug and say, oh, it's, dry mouth or other things that they just are not happy with. So it's always best to try something you can do naturally, no side effects.
So the drugs have some unpleasant side effects.
Yes, yeah.
And the side effects of the exercises are going to be much more long-term.
Yes.
You're
yeah.
going to train those muscles are going to be trained and stick with you for a long, long time.
That's right.
And you're going to save yourself a whole lot of money, not only in drugs, but in all of the other paraphernalia.
Exactly.
In terms of other supplies that you may be using for a lifetime.
Correct.
Yes.
Correct. And also to mention that it can progress in a negative way, that it could start with maybe just sneezing and having a little bit of a problem there, to developing into, so that's something to note, that if there's a little problem, seek help now, because it can develop into a bigger problem. Yeah.
Differences for men and women. These exercises
Good
can be
question.
done by both men and women.
Yes. Men, sometimes if they have prostate problems, may develop incontinence, but they have the same muscle structure that we do. So men or women, I see both in the clinic. So it's not just a female problem. I mean, women, we have children, and it's a traumatic thing for our muscles. I see both male or female patients.
So different problems may affect our muscles.
Exactly.
Whether men or women, but both sides have problems, and both sides can be strengthened.
Yes.
Okay.
Correct.
That's good to know. And you say about how many weeks before changes are seen?
So usually within a month, I look for any type of improvement. The other thing we didn't mention was waking up at night. That's a big problem here at Green Spring.
Sure.
Waking up, so if I have someone coming to me on the first day that says, hey, I'm waking up 4 times a night, having to go to the bathroom. This is interrupting my sleep, not to mention the risk of falling on the way to the bathroom at night. We look for any improvement. Usually within a month, we can bring that down to maybe waking up 2 or 3 times. So any type of improvement, I usually see something within a month. And so that's, yeah, my goal is to teach how to do the exercises, not to completely resolve the issue, because that does take several months, but getting someone independent and knowing what to do to take care of themselves, then I set them free and say, go ahead and do these at home. And
can the issue be completely resolved?
It can. It actually can, and that's the
good news.
Yes.
Yeah.
It really can. You know, it's one of those things that I see residents that are so happy with even a 50% improvement, you know.
Yeah.
But I've also had residents say, gosh, you know what? I am completely dry. Thank you so much.
So we can stop using the word incontinence.
Yes.
And start using the word continence.
Yes, I love that.
That's wonderful.
Yes.
That's good.
Yeah.
Well, it's quite different from one of the gentlemen that works here in the station and I, when we first saw this title, we both said, I didn't know anything could be done.
See?
And that's really exciting to know that it can be.
Yes.
We just have about 1 more minute, Nancy. What else would you like to tell us before we close?
I'd like to suggest drinking more water for everyone. That's usually a surprise. People think they need to drink less to have less of a problem with incontinence. Drink more water. It keeps the bladder healthy and happy. And that's it. If there anyone out there that has problems with incontinence, seek the doctor. You know, feel comfortable talking about it. It's not anything to be embarrassed about. And there's help out there.
Okay.
So
good news. Thank you so much for joining us.
Thank you.
Okay.
Thank you.